Hi people, in this video we want to look at the causes of hyperprolactinemia. Okay, that means more high prolactin hormone, why and all it can happen. Okay, so this hyperprolactin hormone will lead to what? Galactorrhoea. Now what is Galactorrhoea? The milk production, right? So basically we'll try to understand everything here. Okay, just step by step. So just look at this. So here's a beautiful face. Don't know how to draw. Yeah, a very smiley and nice face, and here is eyes. Okay, here you have the pituitary gland. In the pituitary gland, this is the anterior one. Okay, this is the anterior pituitary. Now from here you have one hormone that is coming out. Okay, that hormone's name is prolactin. Okay, so prolactin is the one that is excess here, hyperprolactinemia, remember. So more prolactin is coming. This prolactin will lead to what? Galactorrhoea, that is milk production. So this is the breast, and from the breast you have the milk coming out. So this breast, whatever I am saying, it can be male or female breast. Okay, so from here what is coming out? Milk. Okay, so milk is going to come out, or milk is being produced here, right? So this is lactation. So people who have hyperprolactin may or may not have Galactorrhoea. You understood this, right? So this is what you have to understand. So what does prolactin do? It will stimulate milk secretion, but it does not actually, it does not cause breast development. Just remember, it only stimulates milk secretion. Hence, this prolactinemia can be associated with Galactorrhoea. That's all we had to tell. Okay, now let us go look at the causes. Before that, okay, we have to also cover what is the normal limit of prolactin in the blood. Okay, there are some there are a lot of measurements based on whether the person is pregnant or not pregnant, or if they are on other drugs, or if they have some other condition. Okay, all that is there. So you can look at this in detail. Just remember that you should actually check for prolactin levels and not for macroprolactin. This is very important because the textbook says that some people are not distinguishing between prolactin and macroprolactin, because macroprolactin is something that is not going to cause much of a problem. That's why they say that just because it is high, you don't have to start treating it. This is something that is not even causing any problem for the patient. Okay, so only if prolactin is high, then only they are telling you have to work on it. Okay, free people, how is it going so far? So why have we come to this video? Only to look at the causes of this hyperprolactinemia, right? So there are three categories we will look at here: physiological, pathological, and drug induced. Physiological means what? It's normal to expect that, right? Then pathological means what? Something is not right. Drug induced means what? You know the cause. Some drug is causing the problem. Okay, so this is what we will look at now. First, let's look at physiological. What say people? Okay, physiological. So physiological problems, obviously lactation. A baby crying can make the breast to release milk, right? Nipple stimulation, obviously, that I will say is something similar. Coitus, that is sexual intercourse again. So these are some things that you can understand. Then pregnancy, see, always they are saying when somebody has hyperprolactinemia, you check for pregnancy. Okay, that is the first check you do. That's what they're saying. So I think all this category is understandable. Physiological, lactation, baby crying, nipple stimulation, coitus, pregnancy. Okay, so we will leave this part here. Now let us go to this part, which is also physiological. They are saying stress, post seizure. If the person, because I have a feeling post seizure and all is some high brain activity, right? Sleep is actually a rest. Then why is that person getting hyperprolactin? I didn't understand. Exercise again sounds like a very hyper kind of thing, if it is a lot of exercise. So anyway, so these are the things the textbook says. So physiological, what and all you saw on this side, you saw that the lactation, baby crying, nipple stimulation, coitus, pregnancy, etc. On this side you saw that there can be post seizure, that is stress, then there can be exercise, then there can be sleep also. Okay, so that's all physiological. Now let us move on to pathological. Pathological, why can there be hyperprolactinemia? Okay, so look at this, some problem with pituitary, that you understood, right? Some pituitary problem only will be there. That is the guy who's producing all the prolactin. So you understood, right? Who is producing? The pituitary is producing. So some pituitary problem. And now tell me, who controls the pituitary gland? The hypothalamus. So there can be some hypothalamic disease. So you understood, right? So what they are saying is it could be the pituitary problem. Let me mark here. We'll use some pathological color here. Prolactinoma, again something to do with some kind of a tumor there. Pituitary tumor, hypothalamic disease. Okay, that all that kind of makes sense, right? Then hypothyroidism. What is this cause? Why is there hypothyroidism? So that's why, this hypo, some kind of a hypogonadism also they were saying. Okay. Then, what else? Pituitary macroadenoma sounds again like some kind of a pituitary problem only to me. Okay. What is this disconnection hyperprolactinemia? Example, non-functioning pituitary macroadenoma. We'll have to read about this. Actually, this one, what they're saying is it's nothing to do with the prolactin. Actually, what is happening is it's more of dopamine problem. Okay. So, what they're saying is there is disrupted dopamine release. Okay. So that is why there is some kind of a disconnection. It is not because of the direct thing that we told you. So disrupted dopamine release. Okay. So that is leading to some kind of a hyperprolactinemia. Okay. Disrupted. Okay. Yes, I forgot. Okay. So you got that right. Then hypothyroidism we covered. Polycystic ovarian syndrome. What is happening in this? Polycystic ovary syndrome. So the follicles are not releasing the oocyte, correct? So that is they're not there is no ovulation basically in these people. So that is something that you have to pay attention to. But why does it lead to high prolactinemia? What is the cause? For this condition, actually, they are blaming estrogen and hypothyroidism again. Okay, we'll just put it here due to estrogen or due to hypothyroidism. So that is what they are saying that can happen. Okay. So just remember that. Then we already told you about pituitary tumor hypothalamic disease and renal failure. Why renal failure will cause renal failure? Why will it lead to some disruption in hormones? Well, the cause is really very weird. It is because of reduced clearance and increased secretion. Just say reduced clearance. Increased section could also be there. But basically, the kidney is not able to remove the prolactin. Okay. Then coming to other things, rare is what? Chest wall reflex. So chest wall reflex is what? Something to do where the mammary glands are there, is it? Okay. So these are all pathological. So these are all not green. So you understood, right? Pathological. Now you summarize the pathological ones. Yes. So the pathological ones are like problem with the pituitary itself, problem with the hypothalamus. Okay. There could be hyperthyroidism. I'm trying to draw a thyroid gland. Don't feel bad. Okay. Please. This is a hypothyroidism. Then there could be some chest wall reflex. There could be some kidney disease. These are two kidneys I'm trying to draw. Okay. Then what else did they say? Pituitary tumor, not disconnect. I mean, disconnection also can be there because of dopamine. What else did we see? Any other organ? Am I forgetting something? Polycystic ovary syndrome. Sorry. So ovaries also you should draw. Okay. Kidney we drew. Chest wall we drew. Only this one, polycystic ovary, I forgot to draw. Okay. Look at the two ways by which pituitary tumors can cause hyperprolactinemia. One is by directly secreting prolactin, so it's going to directly secrete more prolactin. The other is where this dopamine effect, the inhibitory effect will not be there. That will be interrupted, okay, because of some compressing the infundibular stalk, okay. So this dopamine is coming from hypothalamus, looks like. The hypothalamic dopamine, which was supposed to have this inhibitory effect on the prolactin secretion, that has been interrupted, okay. So this is the disconnection hyperprolactinemia. So there is more information on that disconnection one. You got it right? Shall we move on? Very good. So next is drug-induced people. You're almost at the last part of this video, the third part of it. So the drug-induced causes of hyperprolactinemia. So dopamine antagonist. So again, something is not allowing the dopamine to work. The dopamine was supposed to go and inhibit the prolactin secretion, but that dopamine is not being allowed to work. So who are those people? Like antipsychotics, antidepressants, antiemetics like metoclopramide and domperidone. So these drugs you should be very careful. Okay, metoclopramide and domperidone. Okay. So if somebody is having nausea, vomiting, you'll just give this and they'll land up with what? Lot of milk secretion possibly. Antidepressant, you will treat them nicely and they'll start secreting milk or what. Then you'll give them antipsychotics. Okay. And then they'll start secreting milk. Okay, something like that you try to remember, okay? Then dopamine depleting drugs. So same thing, same effect. Dopamine is being shunned. So dopamine, control the dopamine. Somebody is controlling the dopamine. Who? Reserpine. Methyl dopa. Methyl dopa I can understand is used for treatment of what? What? Both of these drugs are actually used to treat hypertension. But I can't find any brand that is manufacturing and selling this in India. Okay, then dopamine, these will deplete. Okay, but how? Why will they deplete? Anyways, we'll not go into that. Then estrogens, we already told you, estrogens will cause what? Like polycystic ovarian syndrome. They will lead to hyperprolactinemia. Okay, so where will you find estrogens? In oral contraceptive pills. Okay, so did you understand drug-induced causes for hyperprolactinemia? So just understand, if the cause is dopamine antagonist, what will be the treatment for hyperprolactinemia? Dopamine agonist, correct? So examples of treatment we have written here. See, let me zoom it a little for you. So the treatment of the condition will be by dopamine agonist therapy like cabergoline, bromocriptine, quinabolide. Okay. So these are the actual treatments. So you understood when it is drug induced, and you know what opposite drugs to give to treat this condition, right? So that's all we wanted to cover in this video. Let's take a quick recap. Okay. What are the causes of hyperprolactinemia? That is excess prolactin hormone in the person. This can lead to Galactorrhoea, that is milk production, lactation, basically in the absence of breastfeeding. There is no breastfeeding. That's what it can cause. Okay, that is Galactorrhoea. So prolactin is a hormone which is secreted by anterior pituitary, so that you should know. And these are the normal levels if you want to see in different conditions. So the causes of this excess prolactin can be because physiological, pathological, and drug induced. So physiological means something is going right, and hence there is hyperprolactin hormone. Or pathological, it should not work that way, drug induced. Okay. So physiological can be because of these conditions like lactation, baby crying, nipple stimulation, sex, that is intercourse, coitus, pregnancy, check. So you should always first check pregnancy, okay? Or it could be this stress, example, post seizure, exercise, and sleep, okay? So sleep also can lead to excess prolactin. This one thing is not registering in my mind. Why would sleep cause this problem? Okay, stress and exercise, I can still put them together. Okay, then coming to pathological. Pathological, commonly what the problem is, they're saying pituitary macroadenoma non-functioning. Basically, there is a disrupted dopamine release. The dopamine is required to control the secretion of prolactin. That dopamine is not allowed to work. Okay, so this is disconnection hyperprolactinemia, or it could actually be a problem with pituitary prolactinoma, or there could be hypothyroidism, okay, or there could be polycystic ovary syndrome. This will have this condition of excess estrogen. Remember, estrogen is the cause for all this high excess prolactin. Then it could be pituitary tumor. I'm sure that you will write anyways. Hypothalamic disease, that is the master of the master who controls the pituitary, hypothalamus. So that guy could have a problem. Renal failure can be a cause because kidney will help in the clearance of this prolactin. So there is reduced clearance, and possibly there is increased production also. And there could be a chest wall reflex. So I'm thinking, post herpes zoster, they are saying. So post this viral attack. Okay, so because the chest wall is what? This only, right? Mammary gland here. Okay, then coming to this, like we told you, pituitary tumors can cause the it can lead to secretion of prolactin, or it can interrupt the inhibitory effect of dopamine, okay, which was supposed to control the prolactin secretion. That controller, that dopamine, has become dopamine interruption. So basically, let me draw this in one way and explain, okay. So dopamine was going to have an inhibitory effect on this prolactin secretion, but this dopamine has been interrupted. Okay, then so there is so much of secretion. Drug induced dopamine antagonist, somebody who doesn't allow dopamine to work again. So that is antipsychotics like phenothiazines, butyrophenones, antidepressants, antiemetics like metoclopramide and domperidone, dopamine depleting drugs like reserpine, methyl dopa, which are used to treat high blood pressure, Okay, dopamine depleting, dopamine antagonist, focus people, estrogens like oral contraceptive pills, obviously estrogen being more. Okay, so that's all that you learned in this video for hyperprolactinemia, what the causes are. Bye bye.